Hi, I'm Dr. Janice Jurack from Muskego Health and Wellness Center. I want to talk to you today about your feet. It is springtime going into summer. People are now mowing their grass on uneven surfaces. People are starting to wear flip-flops, which are not supportive and really good for your feet, by the way. And people are starting to walk outside and run. Many people then start experiencing pain in their feet, whether it's on the bottom like plantar fasciitis or in their heels or even the calves. I want to show you a couple things that I look for in the feet and then also show you how we are able to treat those conditions and some options for you. So I have a volunteer here. We're going to look at her feet, if you want to turn that way for me. The first thing I look at are the arches. You want to be able to stick 2 fingers just like this under the arch of the foot. Now you do this standing because some people actually have high arches when they're sitting, and as soon as they stand up they don't have the proper support that they need in the arch. And actually part of that can come from the lower back. Part of that lack of support can come from the hip. Believe it or not, part of it can come from the stress gland, the adrenals, because it weakens a muscle in the leg that supports the arch of the foot. So if you're under a lot of stress, it can actually affect the arches of your feet. Proper footwear is a must. Like I was saying before, flip-flops are terrible. If you are an avid runner or exerciser, I encourage you to go to the specialty stores, running stores, to get your shoes. It does make a difference as far as quality and material. So you don't want to have a shoe with a defect that's going to actually make your feet worse. So when I go like this, I am unable to get my fingers under there. So she does what we call overpronate. Same thing there. One thing I would do on this particular patient or person would be to do a foot scan to see how bad that overpronation is, to see if a shoe insert would help to support those arches, or even a customized orthotic to make sure that the arches are supported properly and take the stress off not just the feet, but the knees, the hips, and the back, because those also get affected by the feet. All right, so I'm going to have you lie on your back for me, please. Face up. Okay, so you have many, many bones in your foot. Can you bend your knee for me? Thank you. So to assess these bones, do an assessment here, especially the heel. The heel tends to be one of those bones that can easily lock inward and cause a lot of heel pain and plantar fasciitis. And yours is locked inward. So we're going to move to the other leg here. Do the same thing. There should be a nice spring to all those joints. I'm going to turn around here. And if you could bend your knee for me, there's a little bone on the outside of the foot that should move up and down freely. I notice that a lot of runners, especially if they're running too much on the outside of their foot, they're going to get lack of movement in that bone. And then we'll try this one here. Tender at all in here? Any tenderness?
It's tight.
A little bit, okay. So I'm going to just demonstrate how I would adjust this bone called the cuboid. We utilize a little board. It sounds much scarier than it is, called a toggle board. We're just going to put your foot right on there. You could put your knee this way. And that gives us a nice quick drop so that we don't need a whole lot of force to get that bone to move or get it loosened up so that it's moving properly. Still a little bit in there. And okay, for the heel, try to bring it out. Good. Okay. And sometimes I will warn people I'm going to yank on your foot so that they know it's coming. All right, you can sit up here. We also utilize an instrument here. Some people call it the little woodpecker gun. Pulses 12 times a second, but it works really well. Been able to take people that have had plantar fasciitis chronically for years and adjust the areas of their foot that have been restricted to smaller areas and have them within 1 or 2 treatments leave pain free. So I'm going to have you, can you bring this foot up on this leg for me?
Probably.
Okay, that's good. And I'm going to go ahead and muscle test this. So let's use this arm so everybody can see. I'm going to have you push up for me. Now when I hit a spot that actually weakens her, I know that's where I need to adjust. And the inside arch of the foot actually correlates with your spine. If you look at reflexology, push up from the sacrum and low back all the way up to the neck area, push up. Oftentimes we'll find there's an arch that runs across the foot. That can be a problem too. And I'll check all parts of the heel, push up. Relax your foot and push up with the arm. And even the top of the foot and the toes, especially the big toe, extremely important. The big toe, we push off on that big toe every time we walk, or we're supposed to push up. And one sign of that big toe not working properly oftentimes is bunions, or the formation of a bunion. Now if you've ever sprained an ankle and have not rehabbed it, that will affect your feet and makes it easier for you to sprain that ankle as you walk around. Okay. So I would do both feet and then go ahead and stand up for me. And then I'd even check her standing with the knees and the shins. So I'm going to have you push up with your arm again. Check to see if the kneecaps might be moved down at all. And that feels pretty good there. Okay. Occasionally I'll even use kinesio tape, if you're familiar with that. It will strengthen anything that is weak. It'll help anything that is tight to relax, helps with blood flow and healing. So if a muscle isn't behaving well, let's say in the calf or even the bottom of the foot, we will then go ahead and kinesio tape the foot in the calf area. So your feet, as you know, if your feet are hurting, the rest of your body's hurting, you're not going to be exercising, you're going to be gaining weight, and frankly probably be a little irritable. So the feet are extremely important to make sure that they're healthy for the rest of your structure, including in young children. You should have a normal arch in your foot by the age of 5 or 6, and if you don't, that can be a problem. So any questions or comments, I welcome them. I'm Dr. Janice Jurack, and I can be reached at 414-422-1203 or drjurack@mhwc.net. Bye-bye.